Okay, this is the anatomical starting or standard position where you are facing forward, your feet are facing forward, your palms are facing forward, and your thumbs are off to the side. And so all of our joint movements are going to be from this position. So the first one that we do is going to be flexion, which is going to decrease the angle of a joint. So what I'm going to do is step to the side just a little bit so that you can see me flexing my fingers. Then I'm going to flex at the wrist. Then I'm going to flex at the elbow. Then I'm going to flex at the shoulder. And so extension is going to return it back to where we started in our beginning position. So as I'm standing here, if I bring my chin towards my chest, I have flexed at the neck. If I bend over at the waist, I am flexing at the waist or flexing at the vertebral column or spine. And then you'll notice that as we return, you go back to the starting position. One of the things that I pointed out in the Zoom meeting was if I flex my chin to my chest, I can then extend my head back to our starting position. And on some good days, I can actually look up at the ceiling. That is called hyperextension. The same thing with bending over at the waist. I am flexing at the spine. I am extending at the spine. And sometimes I can actually hyperextend at the spine. With the shoulder, I'm going to flex at the shoulder, I'm going to extend at the shoulder, and because it's a ball and socket, I can actually hyperextend at the shoulder, as if you were bowling. The same thing with the hip. If I flex at the hip, I can extend at the hip, and then I can hyperextend at the hip, as if I were going to kick a ball. So all of these motions take place at a joint. You just have to say what the motion is, and then you have to say what the joint where the motion is occurring happens at. Not good English, but you get the idea. In the coronal plane, once I'm standing here like this and I move away from that, ABD is the prefix. So abduction at the shoulder would be taking my arm and going out like this, okay? Abduction at the hip would allow me to bring my hip out like that, so that all of that is taking place at the head of the femur and the acetabulum. Okay, so those particular movements, you have to say what the movement is and where the movement has occurred at. I guess I'll repeat that more than a few times. The next one is going to be a special movement which is called supination. So in supination, you are going to have your radius and your ulna parallel to each other in the anatomical position. So this is called supination. When I take my radius on my thumb side and I cross it over my ulna, and all of that action is going to take place at the head of the radius and the capitulum, this is basically what they refer to as pronation. So where would you use something like pronation and supination? Well, if I had a doorknob and I had to go from this way to this way, I am going from supination to pronation to pronation, and I was going to try and demonstrate that with a ratchet. I'm going to go from this way to this way, this way to this way. All of those movements are supination, where the two bones are parallel to each other, and you could of course carry sup. And then you go to pronation, where you've crossed your radius over your ulna and you can no longer carry sup. So that's one of the special movements. The other one of the special movements, if my wife could take a picture of my foot, and I'm going to bring my toes up towards my shin, that is called dorsiflexion. So anytime that you take and move at the ankle, you are essentially bringing your toes closer to your shin, and that is called dorsiflexion. When you put your toes down there like that, that is called plantar flexion. So for any of you who have ever done point in ballet, that's basically the movement that you would have. For everyone, even if you never did ballet, if you're stepping on your gas, you don't lift and do that, you just basically pivot on your heel so that you're stepping on the gas. So that is going to be dorsiflexion and plantar flexion. One of the other ones, and the model that I have on the video, is the one that's going to be pronation and protraction and retraction. So she does her jaw and juts it forward. That's protraction. So any anterior movement is called protraction. I can't do that, but if I were at a gym, I would reach forward to grab the bar, and as I did a rowing motion, my scapulas are retracting. But as my scapulas go forward to grab the bar, I have protracted, and then as I'm bringing them back, my scapulas actually go backwards, and that is called retraction. So although she's demonstrating it with her mandible jutting her jaw forward and then going backwards, it is a lot easier to reach forward and your scapulars are floating around on the top of your ribs, and then as you bring it back, you are retracting. One of the problems that some of you had, particularly the Wednesday and Thursday class, and one of my questions was, if you just take a picture of my foot down there, you'll notice that my toe is going forward as if it were 12 o'clock. And then without bending my knee, I am going to rotate my foot out to 3 o'clock. So all that motion of me going from my big toe going forward to my big toe going out here to 3 o'clock has taken place at my hip. A better way of demonstrating that is if I bend my knee. I am able to stand like this a little bit and then rotate it out like that. So that movement is called lateral rotation at the hip. The same thing is going to happen at the shoulder. So here is flexion of the shoulder, here is abduction at the shoulder, and then as I bring my arm out like that, I have gone away from my midline. This is called lateral rotation at the shoulder. So nothing is really happening at my elbow. I've kept it fixed, and as I go from here to here, I have gone from and made a lateral movement lateral rotation at my shoulder. One of the things I'm just going to add in here, which is going to be what we're going to do when we do the extremities, is there's 4 muscles that make up a group of muscles known as the rotator cuff. The supraspinatus, if I had a ball, I would bring it out like this. That is abduction at the shoulder. Then as I do this movement, which is going to be lateral rotation. So this is lateral rotation, but I'm just going to bring it up here, and as I bring it back to throw a ball, the I and the T of sits is going to be the ones that do lateral rotation at the shoulder. And then in order to throw the ball, and you'll see it's kind of geeky, this would be what the subscapularis would do, and that's going to be medially rotation. So as I bring it back like this, that is going to be medial rotation at the shoulder. So the sits muscles do nothing more than throw a ball. I am going to abduct, that is going to be the supraspinatus, that is also the deltoid. Then I'm going to bring it back, that's going to be the I and the T in sits, that's going to be the infraspinatus and the teres minor. And then as I toss it forward, that is going to be the S portion, and that's going to be the subscapularis. So in addition to all of those movements, I wanted you to get the idea that you can do lateral rotation, but you can do it when you're also abducted, and that's kind of, although it's geeky, that's how you would throw a ball. Shoulders going up is going to be this movement where basically my scapulars are moving up towards my ears, and that is called elevation of my scapulas, and then as I drop it back down, it is going to be depressing my scapulas. They use in the sample that I gave you, she is going to elevate her mandible, which means she's going to bring her bottom teeth up to her upper teeth and close her mouth. It is just easy to explain it as I'm bringing my scapulas up, I have elevated them, and then as I've lowered them down, I have depressed them. The last one that we have there that they show really well is the ability to take your thumb and to touch your other fingers. That movement is called circumduction, or not circumduction. That's going to be the one that's going to allow me to do opposition. So as I take my fingers here and I do this, I have done that movement, which is bringing my thumb closer to my other fingers, and I can pick up the Diet Coke. Okay, circumduction is the last one I'll just deal with. She does this little movement here. I'm going to show you, or I do explain it when I had some of you for the Zoom meeting. I am going to do that. Circumduction is going to be 4 movements in order. So if you do a wind up to throw a softball, you have to go forward, then you go out, then you go back, and then you come close to the body. So this is flexion, this is abduction, this is extension, and this is adduction at the shoulder. So that wind up is all four of those movements: flexion, abduction, extension, and adduction, all pivoting where your head of your humerus goes into your glenoid cavity. Any questions, feel free to email me.